session. In this podcast, we will be discussing about vitamin D. Recently, there has been significant changes in the understanding about vitamin D, its role, its deficiency, and how much is the adequate level of vitamin D is. There is a lot of misinformation and a lot of pseudoscience which needs to be debunked so that we could have evidence-based information to our viewers. I have been a primary care physician for last 25 years and I've been serving Florida for since then. Vitamin D. Why there is so much of controversy about vitamin D and why there is a misinformation. First source of information is science is a evolving field. In science, if we become stagnant and we have fixed opinions, then we will not grow, we will not be on the side of truth because our truth changes as our circumstances changes. It used to be a lot of confusion. A, what is the role of vitamin D in your health and body? Second, how much vitamin D replacement you need? What are the alternative therapies? What we could do naturally to improve it? We will take in this live session all these questions in detail so that you could understand about vitamin D. By definition, vitamins are the chemicals which our body is incapable of making it. So our body endogenously does not produce any vitamin of any class. Vitamin D is a fat soluble vitamin and it is a very important in our gene expression. There is not a organ system in our body which it does not get affected by vitamin D, and also it plays a very critical role both on our physical health, emotional health, intellectual health, and these domains spill over to your spiritual health and social well-being. Vitamin D, by the fact that its receptors are present on every cells, every organ system, every cell in the body, that makes its function very ubiquitous. And if there is any problem with vitamin D, you will have all domains of life being affected physically, emotionally, intellectually, and socially. Vitamin D. Let's discuss about the body first. Main organ systems where vitamin D is of utmost importance, not in a particular order, we'll start with our bones because we all know vitamin D with the bone. Vitamin D is essential to be present in the body in adequate strength so that whatever calcium you are consuming in your diet gets absorbed from your gut. And when the calcium is circulating in the blood, and once it gets filtered into your kidneys, and to reabsorb calcium from your kidneys, you need vitamin D. And it helps to push this calcium into your bones so that you do not develop osteoporosis in elderly, osteomalacia when your bones have become soft and you are adult, or rickets, which are bone deformities once you are young. Vitamin D, by the fact that it controls and impacts calcium, there is not a chemical reaction in the body where calcium is directly or indirectly not involved. So that's why not only in the bone health, which we talk about regarding osteoporosis, it affects every organ system in the body. The way the cells communicate with each other is through action potential, especially your nervous system. both peripheral nerves, receptors, and the brain, and calcium is an integral part of that. And that's how vitamin D indirectly affects there. Vitamin D receptors are found in your brain, in your heart, in your liver, in your kidneys, in your gut, muscles, tendons. When vitamin D gets into your body, it can come from two sources, either from animal source, which is cholecalciferol, and or in from plants, which is ergocalciferol. Bioavailability of animal sources is higher than the plant one. After vitamin D gets absorbed, it is carried to the liver, whereas chemical changes happen in the vitamin D molecule. A hydroxy molecule is added, and then it is transferred to the kidney, where there is another molecule of hydroxy molecule is added, which makes this vitamin D active molecule ready for action. So there are three places it has to be absorbed: in the liver and in the kidneys. Once you are deficient in your vitamin D, let's start with the brain. You will be tired, your emotion, your intellectual response will be slow. Emotionally, you will be either irritable or too passive. You could very well be depressed. There is a well known entity which is called SAD, SAD, which is seasonal affective disorder, which is very common in the areas where in winter there is no sun. It is directly related to heart muscle dysfunction, leading to cardiomyopathies, also with the conducting system of the heart muscle. In the liver, not only liver has a lot to do to make it active, it is very well represented in the all the liver hepatocytes, so that it can help you to improve and do the things. Further, it is also present on every immune cell, and being present on immune cells, it modifies the inflammation and cell growth. So you see, because vitamin D receptors are so widely spread all over the body, you will have functions from everywhere if there is a problem. Now, let's categorize the symptoms of vitamin D deficiency. Physically, you will be tired, you will be weak, you will lack energy and motivation. Emotionally, you could be irritable, anxious, you could be all kind of emotional upheavals which you not your basic format which you go in. Intellectually, you will have difficulty in processing the information, and you may not be able to come up with reasonable solutions, and that will impact your productivity. Socially, because you have lost your physical energies, you will have difficulty in getting socially acceptable and socially doing this one part. That's why what makes this vitamin D so difficult and so much important. Now the question always comes in is, how do we check vitamin D deficiency? Most of the time, whenever you go for a physical or you see your primary care physician, this is one of the tests which gets ordered, and we will check your vitamin D level. There has been a lot of debate about what level of vitamin D is acceptable. If you go to functional medicine physicians, they want to have your vitamin D level very high, into high hundreds. But the evidence based on all the current studies is as follow. We used to believe that any vitamin D level less than 30 is probably low, which is not substantiated by the current literature. Now we very well know that anybody who has vitamin D level less than 12, that is definitely patient is or person is vitamin D deficient. If vitamin D is between 12 and 20, you have a borderline vitamin D. Between 20 and 30, it is acceptable. And you want to push it up to, if you are very enthusiastic, you push up to 50. The interesting point was there is definitely a proven complications and increase of risk of all cause mortality when your vitamin D level is above 60. So the old concept by the which has been kind of widely spread, push vitamin D as much you can. Like anything else, vitamin D is not innocuous. If you do too much of this, by the fact that it's so widely represented in the body, it affects. But definitely, if you keep your vitamin D level above 30, up to 50, you have increased energy level. You will be able to get um, all cause mortality goes down. You will have a less heart attack. Your kidney will function properly. Your prostate function will improve. Your ovarian functions will improve. There is not an organ system which doesn't improve if you keep vitamin D level in the therapeutic range. As I said, vitamin D is a fat soluble and our body doesn't make it. There are two diets which are very crucial in formation of from where you could get vitamin D. One is the animal sources. Animal sources are fatty fishes like salmon, merkel, fish oil, then beef, eggs, chicken, cheese. To some degree, once it's fortified, there is very little vitamin D in dairy, but once it gets fortified, you have adequate amount. And then certain mushrooms. Vitamin D not only comes from dietary sources, under UV light, UVB light especially, when we are exposed to sun, body can make vitamin D. And certain mushrooms, when they are exposed to sun, they also can make vitamin D. So that makes them very good plant source for vitamin D replacement. And if you go to supermarket, on the package they always say sun exposed. If you have mushrooms which are sun exposed, that means that it will be effective in increasing your vitamin D, and probably that mushroom has a higher concentration of vitamin D. How much vitamin D you need on daily basis? It is now very clear that anybody below the age of 70 need about 400 to 600 international unit. Anybody who is more than 70 needs about 800. The guidelines are ambiguous there. Most of the evidence says you do not need more than 600. But if we stick to the previous understanding and the current the guidelines, I think if you take between 4 to 600 below the age of 70, and if you're more than 70, 6 to 800, you are in a very safe range. And get yourself checked. Think which the core message is, we used to believe that vitamin D, if it's running high, it does not have consequences, which is proven to be wrong. Because we know for a fact now there is a increase in all cause mortality. Next comes in is what can we do to improve our chances that we don't develop B12 deficiency? It is very easy. A, eat balanced diet, meaning diet which has everything, both quality meat, especially fatty fish like salmon, mackerel, quality beef, quality fats, complex carbohydrates, fruits and vegetables, mushrooms, and above all, get out in the sun. And the color of your skin has a lot to do how much you have to be outside. If you're a fair skinned person, you need to be probably 15 to 20 minutes outside, and your body will be able to convert enough cholesterol into vitamin D. If you're darker, then you will have difficulty in converting cholesterol into vitamin D, and you have to probably stay out longer than the fair skinned people. And the timings are very important. The timing is usually between 10 to 4. If you do before 10 and after 4, they have found it out there was a less benefit than the this between the hours of 10 and 4. Now, what are the other things you should know about vitamin D? A, vitamin D is not a simple innocuous product. If you have a problem, if you take more than you need, you have consequences. Next question was, can you get enough vitamin D from sun? And the answer is probably yes, provided you have a balanced diet which is providing you enough in the form of dietary. But if you are trying to replace your total vitamin D requirement based on sun exposure, probably that will not happen. Vitamin D deficiency signs and symptoms, and that question has been sent to in the chat right now. They are very vague. It's not like very specific one symptom which will make you suspicious of vitamin D. But general things are, if you know you are not eating properly and you know you're not getting in sun and you have difficulty with fatigue, mental fog, concentrating, and you have achy bones, consider that there could be a possibility of vitamin D deficiency and get yourself checked. Next question is how much vitamin D is enough, which I've just now covered it. I think that will be suffice to do that part. Next question, can vitamin D lead to depression? Yes, it is proven fact vitamin D deficiency, especially in the winter months, can lead to depression. And the mechanism is that way our brain feels different kind of emotion is through neurotransmitters. When you don't have sun exposure, the level of melatonin goes up in your brain and serotonin goes down, and that leads serotonin is the mood stabilizer and neurotransmitter, and that leads to depression. So yes, a vitamin D deficiency directly or indirectly can lead to depression. I have talked about the effects of vitamin D deficiency in young adults, which is rickets, where the bones becomes deformed. Sometimes they are bow-shaped and abnormal, leading to gait problem and pain and suffering rest of their life. These days, we do not see much of rickets because most of the foods are fortified. Next question was, should everybody be taking vitamin D supplements? I think this is a very big and blanket question. I truly believe that if you are not eating right and you don't have a sun exposure, you should consider taking vitamin D. I hope I have answered most of the questions which I've gotten in chat. If you have any question, write in a comment and I will answer those questions. I hope this was helpful. Thank you very much for your attention. Please do not forget to subscribe to our channel, Kundlas MD. Like, share, and subscribe. And we will meet you in next podcast on Saturday. Thank you.